Welcome. Today is our first edition of the Pain Care Specialists of Oregon Facebook Live and YouTube interview with Dr. O, Dr. Andrew O of Pain Care Specialists of Oregon. How are you?
Good. How are you today?
Excellent. Dr. O, tell us, we are curious as to how you became interested in chronic pain management and weight management.
Oh, well, chronic pain management was mainly to, help people who have to deal with um, chronic pain that interferes with their daily function, interferes with their relationships. It can be quite debilitating, and I had an opportunity to um, do a fellowship in chronic pain, and so that's what got me interested in that. In terms of weight management, I think weight management, again, when we talk about weight management here at Pain Care Specialists, I think the biggest thing is really overall health. We're really trying to push for better overall health for our patients. And, um, I would say most health experts, most physicians can agree that improving overall health helps with multitude of issues, not just chronic pain. There's never really been any major studies to show that there's a direct link with obesity and chronic pain, but there are some smaller studies that show that there is a link, especially central obesity or truncal obesity can increase
I
sensitivity
see.
to pain.
And how do you plan to start treating obesity? And is this only for obese patients? Are there any benefits to treating patients who are not necessarily obese?
Oh, correct. Yes. Again, we're talking about overall health. Obesity is one symptom or one issue that we deal with in health in medicine. Um, but it can be a signal of improvements to be made, and there are lots of links to other comorbidities such as
Hmm.
diabetes, heart disease, stroke, things like that. But you don't have to be obese to get benefits from having a better lifestyle, having a better diet, improving your overall uh, body mass index, improving your uh, fat content. Those are all um, things
We
that
have a
anyone can improve from.
Excellent. We have a question from one of our viewers. How do you think is the best strategy, or what are your treatment steps for all patients, or do you have customized treatment steps?
Yes, I think from the different studies of between diet and nutrition, I think the number one factor is adherence. So we're here
Mhm.
to help patients stay consistent, stay accountable, and adhere to any multitude of different changes that we can make. And they're going to be incremental changes. We're not going to be able to, make huge drastic changes all in one fell swoop. So we want to make sure that we let the patients know that we're here for them, that we're going to be going through this process together, and that we're going to be step by step going through some different ways to help improve uh, their overall weight, but also kind of their overall health.
One other question we have is, what's the big deal about obesity overall in healthcare right now? Why do you think it's so important to treat this,
Yeah,
particularly?
as I alluded to it just a few minutes ago, really obesity is linked to many comorbidities that are um, directly linked to preventable mortalities in the United States, namely heart disease, stroke, cancer. It's linked to diabetes, high blood pressure. These are all um, factors that are linked to obesity, and chronic pain is also uh, loosely linked. But I think anytime we can help someone's overall health and improve, you know, their risks or risk factors for these other mortalities, I think that we're doing a service for our patients.
And why did you choose this opportunity, this time, to start this remote patient monitoring? And is it because of the crisis right now? Does this have anything to do with the COVID pandemic?
I mean, I think it definitely had a influence on when we were thinking about starting this. I mean, it definitely made people more comfortable with video conferencing, doing telehealth, telemedicine. Those things, patients have been more comfortable. They have the ability now. They have the technology now. They understand how to use it. And I think that allowed us to kind of piggyback on that and said, look, this is a way that we can help our patients. They don't have to come into the clinic. We can do all this remote patient monitoring via telemedicine, telehealth. And I think the patients are going to benefit greatly from this.
And who at the clinic will be doing this at Pain Care Specialists?
All our providers. All of our providers have gone through nutritional training. They did a course from Harvard, and we're continuing to educate ourselves. So there's 4 providers that are physicians, and we have 3 providers that are physician assistants, Dr. Kung Vu, Dr. Young-In Cho, yourself, Dr. Poli Chen, and then myself. And then we have our PAs, Don Winder, Nash Keene, and David Keene. And they've all been trained. We have weekly meetings about how to improve this program, how to continue. It's a new program, so obviously there's always going to be room for improvement. But I think this is going to be great.
So let's say I'm a patient, I go see you, and I am overweight, and I ask, Dr. O, I have had years of chronic pain. Is this related to my weight? What do you plan to do? How do you plan to implement this new treatment?
We have a frank discussion about how obesity can play a role. I mean, obesity definitely has a role in terms of arthritis changes, wear and tear on their joints. There's a direct correlation there. There's also some potential correlation between obesity and inflammatory factors, and increased inflammatory factors can cause increased pain. Again, I alluded to before that central obesity can cause increase in pain sensitivity. So these are all factors that can play a role in their chronic pain. So the way that this program will work is we're going to be having them, sign up for it. We'll schedule them visits with us via telehealth, video conferencing once or twice a month. We'll be sending them a weight scale provided by the clinic, and we will encourage them to check their weight and then report back to us. And then each time we meet, we will discuss some different strategies in improving lifestyle changes, diet changes, and things like that.
What are you measuring? For instance, when you give me a weight and I'm your patient, what types of measurements do you want me to record? And do I have to write it down somewhere? How are you going to get the data? And what are you going to do with it?
Well, it's just a way for us to track their weight, which again is a way to use. We're just mainly using that weight as a signal, as a symptom to other health conditions. And we, the weight scale that we provide has a Bluetooth connection. It comes with an app that you can download. It's free, and you can track those numbers yourself, and it will record it for you. So you don't have to, write it down on a piece of paper, remember where you left that piece of paper. And then when we have that discussion with you, all you have to do is open the app and go through those different numbers. We'll record it in our electronic medical record. And we'll kind of use that as a guide. I mean, again, this, we're using weight as a way to track this program that don't necessarily want people to focus only on the weight, because even though your weight may not be drastically changing, when we make these health, lifestyle and health changes, dietary changes, you are going to gain benefit. There's definitely a lot of data out there to show that you're going to benefit from making these improvements, regardless of whether or not your weight is drastically changing.
One of our viewers is asking, what if I'm not overweight and I'm not obese? Do I still have any benefit? Is there going to be any benefit to these types of patients who are not necessarily overweight?
Oh yeah, yes, of course. Again, as I said before, this is not only about weight. This is about overall health. And you know, there are very underweight people who are unhealthy. There are normal weight people that are unhealthy. There are you know, there are people who are only mildly overweight that are unhealthy, and we're just trying to minimize risk factors for those preventable diseases. You know, we're talking about heart disease, hypertension. You know, you don't necessarily have to be obese to have those conditions. And you know, if you talk to any primary care doctor, they will tell you that that's absolutely true.
Some of our viewers are wondering about diets. As you know, diets have been in the media for decades, and there seems to be a new diet every other month or so. What do you recommend right now?
Well, we don't recommend any specific diet. I think diet fads they'll always be there. They'll come and go. They're always going to be there. There's always going to be some new celebrity or some new fancy doctor online purporting that this new diet is going to change your life. It's going to, you know, melt the fat away, and that's simply not true. You know, when we look at the data, and Harvard's done a really good job of studying the science behind all these diet fads. And, you know, again, when we do our program, we'll educate you on those things. But again, the biggest thing is adherence. And, you know, there's pros and cons to every diet. But, you know, overall, I think my, the thinking behind my plan for my patients is to really focus on fresh fruits and vegetables. And you really, I mean, that you can't really go wrong with that. But yeah, there's, again, every diet is going to be slightly different for everyone, and it's whatever you're going to be able to adhere to for the longest. That's going to be the best diet for you, and it may not be the same for the next person, and it may not be the same for me. So that's why, you know, that's why we do this and personalize this for each patient.
Someone's wondering, Dr. O, what do you eat, and what kind of diet plan do you have for yourself or perhaps your family?
I mean, I don't really like to call them diet plans. I mainly
Why
just
not?
right now I'm focusing because it really comes down to, this is a lifestyle change that I'm going to make for myself. And when we label something as a diet, then we think that it's temporary. We think that this is going to be something that is going to fix something for us, when really we need to make long-term changes that are going to be most effective. And right now, I'm just really focusing, for me and my family, focusing on eating more healthy, fresh fruits and vegetables, making sure that we eat lots of good, healthy fats, nuts in general, and trying to stay away as much from animal products as much as possible, and highly processed foods. But yeah, again, it's not, you know, each individual, even within my own family, we all have different preferences, and so we're not all on the exact same dietary, you know, change timeline.
I see.
I did notice that there was a question about NeuroFlow, and we do have a good program at NeuroFlow is another app-based program that we use at our clinic, which is focusing on mental health. And that is completely different. This is not, this new remote patient monitoring is not related to the NeuroFlow. And so we do use it together in terms of making sure that we treat you as a whole, because we all know that, you know, treating a patient is not just treating one part of the patient. We're trying to treat the patient as a whole, and mental health plays a big part of that. And mental health definitely plays a part in diet, but that part is not specifically integrated into the remote patient monitoring program. We will use it to monitor and track and help our patients who deal with chronic pain in terms of how it's linked to, while we're doing our procedures, we're having them do physical therapy and things like that. But this specific remote patient monitoring program for weight is not specifically linked to the NeuroFlow. So hopefully I've answered that question.
One other question is, why is it important that I use the scale you send to me rather than just any old scale at home that I have? Why do I need to use the scale that has your Bluetooth or whatever you call the wireless connection? These are patient questions here.
Yeah, I mean, there's no, well, first of all, the remote patient monitoring program has to be use equipment that's FDA approved, and this weight scale that we have is an FDA approved weight scale equipment, and so we really need to use in order to stay compliant with all the rules and regulations of this program. So in order for us to utilize this, and bill your health insurance, this is all a requirement. So, it's if everyone is using the same scale, it keeps everything very consistent for us. The Bluetooth tracking is very helpful. Patients tend not to remember to track it themselves. But those are the main reasons right there.
And another interesting question that we have is that what if I don't like being online? I don't have a wireless connection or a fancy computer. Can I still do this? Do I have to use your patient portal?
No, you don't have to use our patient portal. We can we use a different portal system for video conferencing. It's called Doxy.me. It's very easy to use. If you have a cell phone, iPad, laptop, anything like that, that's totally fine. We can also do some of this over the phone if necessary. And we'll work with patients who have difficulty with technology in different ways to overcome those difficulties.
Okay. Other than diet and eating healthy, what else do you recommend for this lifestyle management?
Well, again, going back to the NeuroFlow, in terms of treating patients, obviously mental health plays a big part in this. Also, physical activity. I mean, you can't be healthy without being physically active. And this is especially important for women who are at higher risk for osteoporosis. So aerobic exercise, and it doesn't have to be, running marathons or doing triathlons. I mean, we're talking about 30 minutes of aerobic, like walking for 30 minutes a day. And you don't have to start there. Obviously, everyone has got different levels of activity that they can tolerate when they start this program. Some people are going to be already running marathons, and some people, they may only be able to walk 15 minutes a day. And that's okay. That's why we're doing this program, to help our patients start somewhere, and we help them stay consistent and accountable. And I think a lot of the research shows that when you have this interaction with your provider, it helps the patient adhere. So definitely exercise, aerobic, also strength training is good. Having muscle mass, increasing muscle mass is a benefit as well.
One interesting question here is, what's more important, diet or exercise?
I think it's pretty clear in terms of the data that diet is more important than exercise. Diet is directly linked to all those comorbidities that I was talking about, all those preventable diseases such as hypertension, cancer, heart disease, diabetes. Those are all directly linked to diet. And I mean, exercise obviously does play a role, But if you were to compare the two, I would say right now that the knowledge we have, it shows that diet plays a bigger role.
Circling back to that weight scale, we have a question about how often is the interval, the best interval to weigh myself or patients wondering about how often they need to really weigh themselves. Is there an optimal amount of interval?
I don't think there is a recommended interval. I think it may be up to the patient, but I mean, I think definitely you should be weighing yourself at least once a week. Every day is probably too much. You're not going to get see dramatic changes from day to day, and you may see just normal normal peaks and valleys of weight, and that may be discouraging to some people and may not be the best thing to weigh yourself every day. But if you stay consistent and you can track this over time, I think that's the best thing. I mean, even tracking it once a week, you weigh yourself once a week, but don't look at it until the end of the month and see what the trend is, because we want to really focus on trends rather than, oh, this week I'm up 2 pounds and last week I was down 2 pounds, and those things really can really be defeating, and we don't necessarily want to focus on that.
One of the big fad diets right now is ketogenic diet. If you're familiar with that, let us know what it is about, and what is your opinion about the ketogenic diet?
I mean, the ketogenic diet basically is avoidance of, it's just another fancy new fad for low carb diet. And I think the biggest problem I have with that is that it focuses on eating lots of fats, and there's lots of ways to do a keto diet. You can do a healthy keto diet, and in my opinion, there's a way to do an unhealthy keto diet. There's definitely no good studies out there that show any long-term benefit for patients. There's definitely short-term benefit. You can lose a lot of weight, but again, these diets, there's not enough detail in the diets to help patients. If you're still eating highly processed foods, if you're still eating, lots and lots of animal fat, it's not healthy. Even if you're losing weight, it may not be healthy for you.
I have an excellent question from a person asking about, could a person's weight alone be the cause of their pain?
Sometimes, yeah. I mean, again, there's direct, correlation. If someone is overweight and they have lots of, knee arthritis or ankle arthritis, I mean, that's definite direct correlation between weight and the amount of pressure that's going to those joints. I think those are obvious. There hasn't been any. Again, there hasn't been any in my from my understanding. There hasn't been any direct links to obesity and chronic pain in a large randomized controlled study. But there are some early smaller studies that show there can be, increased inflammatory markers, increased sensitivity to pain. Those are all things that can occur from being obese. And mainly we're talking about truncal obesity, which is the amount of fat that's around the abdomen.
And good fat and bad fat. What's your take on good fat and bad fat? You just mentioned something about the ketogenic diet having quite a bit of emphasis on fat. Should we just all avoid fats?
No, I mean, again, there's healthy fats. You don't want to be eating a lot of animal products, and you don't want to be avoiding. Fat is essential. Fat is essential to the diet. You need to have fat in your diet. Your body requires it. But you don't want to be eating a lot of unhealthy fats.
Where are you getting most of your dietary recommendations? What do you recommend? Because there's so many people and websites. Where do you think our patients should go for reference?
I mean, I think that's where we come in, is that we help patients find different avenues to what could help them specifically. I mean, there are some different websites out there that we use that we can go into when we start the program with patients, but really that it doesn't come down to like one website or one thing. I mean, we've gone through an education program where we've learned about nutrition, we've learned about different diets, and we can help you incorporate that and help guide. Okay, what kind of foods are you eating now? What's in your fridge now? What's in your kitchen? How are you cooking? What do you enjoy? What do you not enjoy? I mean, those are all part of this program. We can't just that's why these diets they don't typically work, because it's not one size fit all for everyone. You can't just say, oh, everyone should be on a ketogenic diet, or everyone needs to be on this next fad diet.
I see. So if I'm a person who actually wants to eat more fatty foods, how would you, for instance, tailor my diet plan for this following week or so? Because I actually do. Let's say I want to eat a high fat content diet. What would you advise me?
Well, I mean, again, like this is, I think we're getting in too much into detail right now. We're still just kind of talking about the overview of the program. But again, this is a conversation, right? I mean, this is not just, oh, I come to you and you just tell me what to do. I need to get information from you. We need to have a discussion about it. We need to talk about lots of different, like, again, what we're talking about, like, what are you eating now? What are you cooking? What do you enjoy? What do you not enjoy? What are your preferences? So there's no one size fit all. I can't just spit out a recipe for you and just say, follow these rules and you'll do better. Because at the end of the day, if you don't like it and you don't follow it, it's not going to be helpful for you. So I think we're getting too much into the details of like, trying to figure out exactly like a prescription. And that's not really what this is. It's not just like a one size fit all prescription for all of our patients. And the whole point of this, if it was that easy, we would just put a list on our website and say, do this. But it doesn't work that way. And humans are very complex, and there's lots of factors and lots of incentives that go into a person's lifestyle, a person's diet, and that's what our program is to provide for our patients.
I see, and that's why you don't have brochures on specific things. You have to tailor it. I see.
Sounds like you're cutting out there.
There we go. Do you see this remote patient monitoring tool being used for other aspects, and has it been used in other aspects of medicine?
Oh yeah, I mean, I think probably the biggest tool for it is to track diabetes and blood sugars. That's probably the biggest thing, making sure patients are adhering to their medication regimen, because I mean that's probably one of the most important factors to track in diabetes is their daily blood sugars, and making sure that obviously hemoglobin A1C plays a big role as well, but in terms of tracking adherence to diabetes, treatment for diabetes, treatment for high blood pressure, I mean, remote patient monitoring can be used for lots of different things. So it's not only for overweight, for weight management. It's really can be used for any number of things.
Our next question is, how many visits essentially would be required, if there is a set visit, to go over all the remote patient monitoring or weight management? Or do you?
Yeah, I mean, I think this is an ongoing program, right? If you look at a lot of the big studies, the people who did the best were people who were in constant contact with someone managing their weight. And this is not something where, oh, well, let's do we'll do a 5-minute conversation for 1 to 2 months and then we'll be good. That's definitely been shown not to be effective in terms of diet, in terms of exercise, all these things. And so I think, one way to think about this is we need to change the way that we view how medicine is brought to us, right? We don't go to the doctor only when we're feeling poor. We don't go to the doctor only when I need this fixed, because that's the whole problem right now, is that we're not preventing diseases. We're trying to put band-aids on diseases that have gone haywire. And so the treatments that we have are very expensive, and they're very advanced, and they work very well. But the problem is we're not treating the underlying problem. And I think this is one way to address it, definitely, is to prevent a lot of these issues. If we can prevent hypertension, if we can prevent heart disease, if we can prevent diabetes, you don't need to be on all those medications. You don't need to be going in, getting stents in placed, and having amputations of toes, and all these different things. You don't have to track hemoglobin A1C if you're not diagnosed with diabetes, if you're able to prevent it. And it is a big problem. I mean, there's a huge obesity problem in our children. So this is when you come in for this program, you're not just helping yourself. You're helping your family. You're helping those around you. I mean, there's the studies to show that people who improve their diet and improve their lifestyle affect the people around them, and you can have a much bigger impact than just yourself. And that's, hopefully this kind of catches fire, and people see that other people are getting healthier and they're feeling better, and they want to do that as well. And when you do this, with a friend, or do it with a partner, a spouse, a child, this has a much bigger impact and is more effective in treating someone's lifestyle diet.
Excellent. So how do I get in contact? How do I start this with you?
Oh yeah, so I mean, you can get referred to our clinic from your primary care doctors. You can make an appointment online. You can refer yourself, self-referral online at paincareoregon.com. And we'd be happy to have someone give you a call back and schedule something. Obviously we have to check some things first and make sure that everything is covered by insurance and things like that. But there's many ways to get in touch with us. It's we try to make it as easy as possible, so hopefully there's not any large obstacles in terms of getting to our providers.
What if I am a new patient? Can I start at that visit? Or what if I'm a follow-up? What if I'm an existing patient? How do you want to start this?
Oh yeah,
do you do it
absolutely.
at the visit, or do you want a separate visit?
Yeah, so a new patient or an existing patient, anyone can sign. We can sign anyone up for this. This program is a separate program from our chronic pain program. So, there will be a separate telehealth visit for this, and we'll be tracking it again, every 2 to 4 weeks, depending on, the patient and how they feel, and probably a little more often in the beginning, and maybe as things go along, maybe a little less often. But, again, that I think we're going to tailor that to each patient.
Okay. Well, Dr. O, thank you very much for this very informative session. And every 2 weeks from now, we're planning to continue on with some new topics, interesting topics. And viewers at Pain Care Specialists of Oregon, feel free to continue to suggest topics to us, and we'll be in touch with all of you. Thank you.
Yes,
have a good day.
I'm excited about this. I mean, I think this is great. This whole COVID pandemic has allowed us to kind of venture out into areas where we weren't too comfortable before. But I think this is a great way to interact with our patients, with our community, and having people just come online and ask questions. I think that's fantastic, and I look forward to more of these.
Yeah, same. Thank you.
Okay.
Take care.
All right.
Bye-bye.
Take care.